Last month, I saw a patient who had been using asthma inhalers for nearly 3 years. She had the blue one, the brown one, and at one point, a purple one. She had done everything she was told. She never missed doses, she followed instructions exactly. But despite all of that, she was still waking up in the middle of night, struggling to breathe. She had stopped exercising because it scared her, and she constantly felt tight in her chest. She sat there, looked at me, and said, "Dr. Paul, am I just not trying hard enough?" And that's when I had to say something I know is difficult to hear. It wasn't asthma, it never was. And the worrying part is this: she is not unusual. I see people like this almost every week. Patients who have been treated for asthma for months, sometimes years, when the real problem is something completely different. I am Dr. Suman Paul. I am an NHS and private respiratory consultant here in the UK. And in this video, I want to walk you through 3 conditions that are very commonly mistaken for asthma, how you can start to tell the difference, and what you should do if your inhalers just don't seem to be helping. Before we go any further, just 2 quick things. First, I'm a doctor, but I'm not your doctor. So this video is for education only. If you are severely breathless, have chest pain, or feel unwell at rest, please seek urgent medical attention. Second, all patient stories I share are based on real clinical patterns, but they are not real individual patients. Confidentiality always comes first. Now here is why this happens so often. In the NHS, the average GP appointment lasts about 10 minutes. In that short time, your doctor has to listen to your symptoms, examine you, and make a judgment call and decide on treatment. So if you come in saying, "I am breathless, I wheeze, my chest feels tight," the most likely diagnosis here is asthma. You are given an inhaler and sent home to see if it works. The problem is that asthma isn't the only condition that causes these symptoms. In fact, there are several others that look almost identical, at least at the first glance. And if you are being treated for the wrong one, no inhaler in the world is going to fix it. Let me take you through the 3 I see most often in my specialist clinics. The first one catches a lot of people out. It's called Inducible laryngeal obstruction, or ILO. You might also hear it being called vocal cord dysfunction. In this condition, the problem isn't in the lungs at all. It's in the throat. The vocal cord briefly close when they should be open, which makes it feel suddenly very hard to breathe. Patients often describe it as their throat tightening or closing. It can come on very quickly and feels quite frightening. There is often a wheeze or noisy breathing, which is why it gets labeled as asthma. But there are some important differences. With ILO, breathing in tends to be harder than breathing out. With asthma, it's usually the other way around. Symptoms are often triggered by things like strong smell, cold air, exercise, talking for long periods, or stress. And one of the biggest clues is that inhalers don't really help. I saw a teacher in her 30s once who had been treated for asthma for 2 years. Every time she raised her voice in the class, she felt her throat clamp shut. Her lung function tests were always completely normal. Once we investigated properly, it was clear it wasn't asthma at all. The treatment for ILO isn't inhalers, it's specialist breathing techniques and physiotherapy. The second condition is one most people don't expect at all: silent reflux. This is a form of acid reflux that doesn't cause the classic burning sensation in the chest. Instead, small amounts of acid reach the throat and upper airways and cause irritation. And the surprising thing is, it doesn't always have to be acid. It could even be non-acid reflux. People often have a chronic dry cough, constant throat clearing, a hoarse voice in the morning, or symptoms that are worse at night or after meals. They might wheeze or feel short of breath, which is why asthma is often suspected. But again, inhalers don't really make a difference. I once saw a man who had been coughing for 6 months and had been given multiple inhalers without improvement. When I asked him if he felt like he was always clearing his throat, he said yes. When I asked if it was worse at night, he said definitely. We treated the reflux, and within a couple of weeks, his symptoms were dramatically better. It wasn't asthma. It never was. It was acid irritation. The third condition is the most important one not to miss: cardiac asthma. Despite the name, this has nothing to do with asthma. It's breathlessness caused by heart failure. When the heart isn't pumping effectively, fluid builds up in the lungs, and that can cause wheeze, cough, and shortness of breath. The symptoms can look almost identical to asthma, especially in older adults. But there are warning signs. Breathlessness that's worse when lying flat, waking up at night gasping for air, swollen ankles or legs, fatigue, unexplained weight gain from fluid retention. I once saw a woman in her late 60s refer to me for uncontrolled asthma. She was already on maximum inhaler therapy. When I asked how many pillows she slept on, she said 4. When I examined her, her ankles were swollen. Her heart function was significantly reduced. This wasn't asthma, and delaying the diagnosis could have been dangerous. Before we finish, I want to briefly mention something else, because sometimes the answer isn't one of the common conditions. A young woman in her early 30s once came to me in my clinic with worsening breathlessness. She had been diagnosed with severe asthma and was on strong inhaler treatment, but nothing was helping. I arranged some other tests, including a CT scan. What we found wasn't asthma at all. It was a rare lung condition called lymphangioliomyomatosis, or LAM in short. Without proper diagnosis, she would have continued to be treated for a wrong condition. This is why lung function tests, scans and x-rays and specialist assessment matter so much. They are not just formalities, they genuinely change outcomes and lives of patients. So let's pull this together. If your inhaler aren't working, it's worth asking whether this is really asthma. ILO often causes throat tightness and difficulty breathing in, especially with exercise or smells. Silent reflux often causes cough, throat clearing, and hoarseness. Cardiac asthma causes breathlessness when lying flat, swollen ankles, and fatigue. And these are the red flags that should prompt further assessment. You have been on inhalers for more than 3 months without improvement. Your symptoms are getting worse rather than better. Your lung function tests are normal, but you still feel breathless. You have ankle swelling, chest discomfort, or rapid weight gain. And lastly, you are using your reliever inhaler more than twice a week. Please don't assume it's just bad asthma. Ask for proper assessment. If you'd like to see me in my private clinic in Liverpool, the details are in the description box below. If you found this video helpful, please like this video. It really helps others find reliable health information. And if you'd like a second part covering rarer lung condition which mimics asthma, let me know in the comments below. I am Dr. Suman Paul. Thanks for watching, and I'll see you in the next video.